Good morning, everyone. Good morning. I just love the vibrancy and enthusiasm in this room. I am so grateful for the opportunity to be with each and every one of you today. My name is Julie Byerly, and I have the honor and privilege of being the president of Geisinger College of Health Sciences, which this amazing School of Nursing is a part of. It is with great excitement that we welcome you to celebrate with us today. It's also a happy coincidence that this is National Healthcare Week. I don't know if you all knew that, but it is an opportunity to recognize the care and support provided by the health profession workforce. And so it's the perfect time to shine a light on the wonderful people that are making a difference here in Lewistown as we educate more and more nurses, which we also desperately need. So thank you so much to the state and local officials here today. It's really a pleasure to have you. And I'm going to wait till later in the program for each of you to be welcomed by the people that live and work here in your community each and every day, because I work across the Geisinger footprint and am so proud of adding this place, this beautiful place, as a bright star in our network of the College of Health Sciences. You know, Geisinger has made a promise to our communities, and we promise to make it easier for each and every one of our neighbors to enjoy better health. It's a simple promise, but it's one that requires innovative thinking, cutting-edge technology, and above all else, well-trained people. And today is a concrete example of how we, as a college, are keeping the promise to train people well and build the health profession workforce that we all need to care for the people and populations that we together serve. Our neighbors in Lewistown and countless other rural communities depend on graduates of schools like this. And it is our promise to understand and serve communities like Lewistown to make communities and individuals better, healthier, and stronger. So this building today is a bricks and mortar symbol of our determination to expand the healthcare workforce and to give young people in this region and not so young people in this region an opportunity to advance their education that allows them to serve their hometowns and their own neighborhoods in what people care about most, their health. You know, we're training amazing nurses here and also bringing in medical students to train here in interprofessional teams. We'll also host young people and not so young people all along the way who we hope to inspire into the health profession workforce. And this building is a promise to everyone in Lewistown and beyond that Geisinger is committed not only to health, but to helping our communities thrive. This nursing school, our medical school, and our residency training programs that are growing in Lewistown model the excellent value-based care that we provide at Geisinger and help to make us all leading the nation in meeting the needs of rural communities. So today we cut the ribbon on a building, yes, but we also celebrate promises made, promises kept, dreams that are emerging, and dreams that are being fulfilled. So thank you. It is with great enthusiasm that I thank each and every one of you who helped to make this possible. Thank you. Now it is my genuine pleasure to welcome Janet Tomkavage, the Chief Geisinger EVP, Executive Vice President, and Chief Nursing Executive. Many of you know Janet Tomkavage. She's responsible for the Nursing Institute at Geisinger, including strategic planning, nursing practice, professional development, and in addition, research and education partnerships throughout the health system. Her leadership was absolutely instrumental in getting us to this day and in nursing education all across the system. So thank you so much, Janet, and I'll turn over the podium to you.
Thank you. Wow, this is impressive. And I will try not to be too emotional. This is, for me, really just kind of it's a phenomenal day. Thank you, Julie, Dr. Byerly, for that introduction. And she said good morning. It's actually good afternoon, but that's okay. That's all right. I just thought I'd call you out on that, Julie. I have to lighten it up a little because I might get a little emotional. I am just so excited to be here today, and I've had the chance to talk to many of you already in this last hour or so. But we're here really to celebrate, boy, oh boy, an incredible milestone that no doubt I think will leave a long-lasting and very positive impact on the future of our nursing teams, for sure, but also, I believe, Lewistown, and I think beyond. We're not just training, our goal is to train nurses that really will be able to take care of the community. But we influence, and we are influenced, and we have been influencing the care beyond Lewistown. So I've had a long and really just phenomenal career in nursing for more than 40 years. I started when I was 10. And I'm really incredibly fortunate to be part of what I consider really a life-changing healthcare discipline called nursing. I really think that nursing, and for those of you who are nurses in the room, I think most of us can say that it's not a career, it's our purpose, and it really has changed our lives. And I know it's changed mine. I'm not sure if folks really appreciate, but nurses at Geisinger make up the largest portion of the Geisinger family, our employees. So we represent about 7,000 employees at Geisinger. We have about 25,000 total employees. And so as a single entity, and there's many Geisinger nurses in this room, we represent the largest portion of that complement of staff. And without it, Geisinger would really not be able to provide the extremely high quality care, the compassionate care that our patients and more importantly our communities have really come to expect. I want to talk a little bit about the importance of nursing. And I suspect I don't really need to get into that too much, but I'm going to. Because nurses continue to be the most trusted, folks that people kind of highlight. But nurses are important in healthcare, and I don't think we can really overstate that. So if you think about nursing, we all think about hospitals and clinics, and you know the nurses that you see in the clinic when you go for your routine appointments. If you happen to have a need to be in the hospital, you're pretty, tuned into the nurses who are helping you get better. But nurses play a role in so many areas within healthcare, nursing homes. And having gone through the pandemic, and our most fragile patients who were in the nursing homes. And we had nurses every day in those nursing homes taking care of, in many cases, our family. Phenomenal job. I saw what they did. We went to the nursing homes. It was phenomenal. They work in patients' homes. We have home health. We have home-based programs. They work in health plans to try and coordinate care. They work in schools, like this beautiful school, and they work in research. They drive quality improvement, and I see some of our quality nurses here today. They provide direct care. They support wellness and well-being. They coordinate services behind the scenes. There really is hardly a service in healthcare that nurses don't play a part and deliver their expertise. The value of nursing certainly has been felt over the last 3 to 4 years. I don't know what we would have done without nursing through the pandemic. We were the constant. We went into the rooms with patients with COVID when many others did not want to come in the room. And I'm looking at many of the nurses from our hospital, so thank you. Nursing students came into those rooms. I'm seeing folks outside the room. We have standing room only space here, so thank you. But the value of nursing. But what's starting to color that value now is really this growing gap in nurses. And Pennsylvania is in a tough spot. Pennsylvania is expected to have the highest gap in nursing of all 50 states. So think about it. Here in Pennsylvania, rural Pennsylvania, we have a growing 65 population, and yet we're going to be faced with the largest gap in nursing. And secondly, we have the third largest gap in nursing assistants, or that extended care team that helps nursing with all the things that we need to do. So our medical assistants, our care techs, our nursing assistants. So we've got to get creative. We, the community, we, Geisinger, to think differently about the nursing workforce. I think most of us know that nurses have a heart of caring and compassion, but they're also these stellar, skilled, deliverers of care that really, when I rounded during COVID at its height, Dr. Rue and I would round together in critical care and med surg, and I don't know how you guys did it. The number of IV pumps and the number of treatments that you were doing. Patients were intubated, they were upside down because it was the best way that we knew how to care for patients. Sounds bizarre, but we turned patients on their belly, prone, because they did better than patients on their back. But all of those things were driven by our nurses. We know that nurses are often the first point of contact for patients. They complete that thorough assessment. They provide care that's really critical to their recovery. And we know that the work that nurses do, and I'm sure if we had anybody get up from nursing, give an example, it's unpredictable. You never know when you're coming in to your shift what's going to happen. But it's also exhilarating. Our nurses walk alongside patients and their families during their deepest grief, their amazing recoveries, and their greatest joy. They manage patients' heart status, their respiratory status. They complete wound care. They monitor the changing clinical status so that the medical team is aware of what's going on, all in an effort to support health and recovery. And I don't want to miss, nurses' roles are beyond, as I said, the hospital and the clinic. They really include advocacy. We've got our patient experience leader here, innovation, research, education, leadership. All those things are led by nursing. And so through the highs and lows, nurses continue to be the constant. They're the trusted face of healthcare for patients, our community, and our colleagues. And so here in Lewistown, the grand opening of this building, this new place of learning, and I hate calling it a building because it's so much more. It's imperative, and it's so special. We're bringing learners, teachers, and our future nurses to the neighbors here in Lewistown, and we couldn't be more excited. We're looking to expand our opportunities. We want to continue to grow the development of nurses for our communities. And what better time than now? Because we need nurses. And I want to pause because Lewistown community saw a gap in nursing. I think I calculated 17 or 18 years ago, 2007, but in 2007 was our first class, right? Okay. So 2005, this community sitting in this room knew that it needed to make a difference. And it did that by committing to the School of Nursing. And so, thank you. Now, we're going to integrate this school into really the heart of Lewistown, into downtown, with our businesses, and this community. So while this physical plant, this physical facility is just a beautiful brand new building, and it's equipped with the latest, like, groundbreaking technology. A couple of us older nurses were talking about not having any of this technology when we trained, and somehow we still came out okay. But today, we need this new technology. Healthcare is so complex. Patients are so sick. The acuity of care is just like unbelievable. And so this facility becomes a beacon. It becomes an opportunity. It really becomes a place of revival, of innovation. And that's how I'm thinking of this, and really what I consider just the best reflection of what is good about Lewistown and what is good about Geisinger really coming together. And for that, I'm just truly honored to be here. So we need our nurses to continue to accelerate their skills, to respond to the ever-changing healthcare landscape. COVID was transformative for healthcare. And while it's not over, we've learned to live with COVID, and we'll continue to learn with the next challenge that we'll face. But we need to assure that the next generation of nurses have the ability to really continuously assess their knowledge, gain new knowledge, to be competent, more than competent, quite honestly. We want them to lead best practice. We want them to change healthcare. We want them to add to the knowledge of healthcare. And that's what this facility is going to help support. I believe that innovative nursing education just is so important to really kind of, for us to respond to the ever-changing kind of challenges in healthcare. And the approach to this building has been so thoughtful that we want to succeed. We want this facility to really support the continued investment and creating an environment really where our students are not going to just learn, but they're going to thrive. I think Julie said the word thrive, and I think that that resonates with me. So our nursing students, our faculty, where are some of our faculty? Put your hands up. Great, thank you. We wouldn't be here without you guys. Our staff from the school, hands up. Great, thank you. I think there's a few more, so either you're not putting your hands up or you're hiding somewhere. But anyway, our students, where are the students? Do we have any students out in the hallway? We've got a couple in the back. We wouldn't be here without you guys. We wouldn't be here without our faculty and staff, so thank you. You are dedicated. Anybody who's been through nursing school or who has worked in nursing knows it's not for the faint of heart. But it is for those who want to make a meaningful impact in our communities and the greater healthcare landscape. As I said, for most of us in nursing, it becomes our calling. And that's why we're here today. We want to make an impact. We want to make health easier. We want to change the health outcomes for Lewistown and its surrounding communities. We're so grateful to this audience, to the support. And Beth is going to kind of say a couple of thank yous to folks that have been so critical in the outcome here that we see today. So we're excited to see the impact of this new school on our professionals, our students, the downtown. And I am just so proud of this moment. I'm so grateful that I can be included and that we're going to change history. We're going to leave a legacy here in Lewistown, and I am thankful that you're here to help us celebrate. So thank you for your time. Thank you for being here, and I just want to now turn the program over to Dr. Bill Jeffries, who is the Geisinger College of Health Sciences Provost, and really one of our leading experts in the nation in medical education. We're so fortunate to have Bill. Thank you.
Wow, look at this. This is impressive. And thank you, Janet. I don't know if any of you noticed that Janet is kind of an advocate for nursing. And we owe her a great debt and her team for all their efforts, their tireless efforts really, to bring excellence in nursing education to this region, especially with the longstanding and aforementioned nursing diploma program that started in 2005, and upon which our new degree program and this facility builds. And if hopefully everyone gets to see the wall that features the history of Geisinger's decades-long commitment to nursing education, and it's very impressive, and I think it even predates Janet's efforts, hopefully. Okay. And so we start a new chapter, and thank you everyone for coming out and sharing our joy in this new building and in our new School of Nursing, And as hopefully many of you know, patient care at Geisinger is unique, and it's because we know our patients, we know our communities, and we use that knowledge to deliver care that is intensely personal, but it's also calibrated to affect the health of entire populations, such as our region here today. And we want it to all be easy, meaning our complex system is presented in a simple, streamlined way that's easy for our neighbors to navigate. And arriving at this vision of better health easier relies in great part upon the nurses who execute this strategy every day. That's why education at Geisinger is also unique and is designed to produce professionals ready to deliver our vision of value-based care. For this reason, certain themes permeate our education. And I think you'll see them on unmistakable display in this new facility. The first theme is active learning. Active learning is the North Star of our educational philosophy in our College of Health Sciences. The patron saint of active learning is the educational scholar and philosopher John Dewey, who once said, "Learning is not the product of teaching, learning is the product of the activity of learners." Thus, active learning demands engaged students who think, discuss, investigate, and create. That's how we produce leaders and problem solvers. So where will you see active learning facilitated in this building? Pretty much everywhere. As you tour the building, you'll note the simulation centers and the technology-rich environment. Our students don't sit passively in classrooms, although I did see some sitting there earlier today. But normally, they don't sit passively in classrooms. They get active, and they do so early in their learning. They'll work closely with the high-tech mannequins that you'll see, mannequins that we want our learners to think of as their first patients. These aren't dolls. They have names: Hal, Anne, Susie, Victoria, and they all replicate genuine anatomical and physiological responses with an amazing degree of reality. Learners who work in these simulations report experiencing the same urgency and focus they later bring to real patients, and they are truly grateful. Hal and Susie were there to guide them. You'll also see task trainers throughout the educational space. These arms and legs and hands allow our learners to repeatedly practice certain clinical skills. No patient wants to be first in line for someone learning how to draw blood or an IV. I don't know how, Janet, you learned, but I learned by taking blood from my supervisor. And he's like, a little to the left, but these trainers ensure that our students are able to practice and master these important skills before using them on a real patient. Our simulation experiences will be heightened in some cases by virtual reality, a new and effective technology to learn clinical skills. It's not just for gaming, but we can learn clinical skills this way as well, and you'll see the virtual reality headsets in the task training rooms. This is one way education at Geisinger fulfills the principle of active learning, that telling a student something is not sufficient for the acquisition of knowledge and skills needed to practice nursing. Rather, it is engagement, application, and experience that are required for authentic learning. Thus, there's going to be a quiz later. I hope everybody knows that. But this is how we achieve excellence in nursing education at Geisinger. These simulations, by the way, rarely involve just one learner, just as healthcare is seldom delivered by a lone practitioner. At Geisinger, healthcare and healthcare learning happen in teams. Therefore, learning in the Geisinger Health Sciences schools also occurs in a team-based setting. Dr. Byerly mentioned the medical students and residents the college has here on the Lewistown campus, and it's our intention to bring these learners as well together to work and function as a team with our nursing students and to learn how to deliver quality care together. You'll see how readily many of the spaces in this building facilitate co-learning. And Beth Finkbeiner is going to talk more about community, but I did want to point out how this building facilitates yet one more core theme of education at Geisinger, which is community immersion. We plan to make this building a place of community gathering and education. We want to make it a place where our learners partner with the community, grow to understand their needs, and use their learning to help these neighbors thrive. As you see, our location in the heart of downtown is the major commitment to this theme. This new building was designed with a uniquely Geisinger education in mind, and that's good news for our students and the community. So now I'd like to introduce Beth Finkbeiner, the director of our associate degree program in nursing, who's been instrumental in getting the associate's degree program off the ground and being our on-site guide to making this facility excellent. Beth.
Thank you, Dr. Jeffries. Good afternoon. Thank you all for attending the Geisinger School of Nursing grand opening. Seeing all of you here and seeing your support and knowing all of you have supported the School of Nursing in many, many ways is just very, very overwhelming, and I thank you. This moment in the timeline of the School of Nursing has been in the making and anticipated for a long time. And so it is so exciting to finally be here in this new building with the Associate Degree in Nursing program. It's just very exciting. I want to begin by acknowledging Geisinger leadership, including Dr. Julie Byerly, Janet Tomkavage, Dr. Bill Jeffries, and Dr. Becky Stout for their steadfast support of the School of Nursing. Thank you. We want to also thank our state and local government officials who have firmly supported this school. Our governor, Josh Shapiro, and his predecessor, former Governor Tom Wolf, Senator Judy Ward, who's with us today, thank you, and Emily Price, a member of the Representative Carrie Benninghoff's staff. This building was made possible in part by Pennsylvania Redevelopment Assistant Capital Program, or RACP, grant. The RACP grants are investments in downtown revitalization, the community, and Pennsylvania workforce. The Geisinger School of Nursing received a $2.5 million redevelopment, or RACP grant award in 2022, which could not have come at a more important time. As hospitals and healthcare systems continue to experience inflation, worker shortages, particularly in nursing, and financial challenges, all legacies of the COVID-19 pandemic. And although Senator Fetterman was unable to be here today, he did send his regards in a gold seal letter, and it reads, "Dear Geisinger School of Nursing, congratulations on the ribbon cutting of the newly upgraded Geisinger School of Nursing. Thank you for bringing educational opportunities to Mifflin County and high-level medical care to rural and underserved communities in Pennsylvania. I appreciate all your hard work and dedication to the people of the Commonwealth. Sincerely, John K. Fetterman." The Mifflin County Commissioners have also contributed financially to this project through the ARPA grant. Thank you, Commissioners Kevin Kodish and Robert Postal, for your support and for being here today. This School of Nursing project makes it possible to over double the class size of the nursing students that we teach right here in Lewistown, ultimately providing a stronger pipeline for nurses in Pennsylvania. We look forward to continuing our partnership with the Lewistown Downtown Association, Mifflin County, the business community, the community at large, and the Commonwealth as we make better health easier in the region. I want to also acknowledge with gratitude Kirk Thomas, former CAO of Geisinger Lewistown Hospital, AJ Hartsock, current AVP of Clinical Operations, Geisinger Western Region, Stacy Osborne, Vice President and CNO of Geisinger Lewistown Hospital, John Zimmerman of Downtown Lewistown Incorporated and a Geisinger Community Advisory Board member, Jim Zubler of Downtown Lewistown Incorporated, Mike Buffington, a Geisinger Community Advisory Board member, Mayor Deborah Bargo, Rhonda Kelly of Juniata River Valley Chamber of Commerce. Thank you all for your support. I must also acknowledge with gratitude the incredible generosity of our dear friends. Helene Runtal, our school library actually bears her parents' names, and the Chapman family, including Susan Chapman. And thank you to the Community Advisory Board of the School of Nursing, the Lewistown Borough Council and Lewistown Parking Authority members, Dan Landisberg, and the entire Geisinger planning team. And I really want to also give a heartfelt thank you to Curtis Klodnicki and Sherelle Willow for ensuring that the School of Nursing building met all of the needs of our program. All of your hard work and dedication has not gone overlooked by us here at the School of Nursing. Thank you. So Mifflin County, as many of you know, is a very, very special place. I was born and raised here in Mifflin County, left for a few years to attend college, and returned to live in Juniata County after getting married to my husband, who was born and raised in Juniata County. So Central Pennsylvania is very special to us. When I went to nursing school, it was not possible to get a nursing degree in Mifflin County. But now it is, and how incredible is that? Many who dream of being a nurse cannot or don't even want to, for many different reasons, leave the area to attend college. So being able to get a nursing degree here in Lewistown has opened so many opportunities for so many people. I personally had even thought about teaching at a college after getting into nursing education over 20 years ago. However, I didn't really want to be driving to Harrisburg or even State College to do so. So having this program right here has opened many opportunities for even the faculty and staff of this program as well. The support of the School of Nursing by the local community has been evident since the inception of the diploma program in 2005, as was mentioned before, because of the determination of its founder, Kay Hamilton, and others who are also here in the room. Their determination to start this program is just incredible. And this program has only continued to grow over the past many years. Being a part of closing the diploma program and opening an associate degree nursing program has just been an amazing journey, one I am so proud of and also humbled at the same time to have been a part of. For those of you who grew up here, it will be hard not to call this the Bon-Ton Building. But today's ceremony will mark the beginning of a new era where this building will be known to all as the Geisinger School of Nursing. Sorry. And yes, my office is located where I spend a lot of time at the Bon-Ton, in the shoe department. I want to thank Geisinger for supporting the School of Nursing, being willing to invest in, what may have seemed to be a small nursing education. But I can tell you it is a program that is having a huge impact on the local community and beyond. Thank you again for your support and for coming out today. I really appreciate it. I'd like to now introduce Dr. Becky Stout. She's the Associate Dean for Nursing Student Education, and we wouldn't be celebrating today without her leadership. Dr. Stout.
Well, thank you, Beth. And thank you, Dr. Byerly, Janet, Dr. Jeffries, for your thoughtful remarks. And a huge thank you again for everybody that we've mentioned today and everybody that we did get a chance to mention. We could not have done this with everybody's support. Well, I have some good news. I get to let you go. So it's time for you guys to hear everything about the building. Come visit. We have faculty and students that are all around the buildings and in the different rooms, so please explore. You have maps. We also have refreshments for you that are in the student lounge, so please help yourself. Thank you for coming out today and sharing with us this joyous occasion. We look forward to everything we're going to be able to do in the future. Right before I let you go, I'm supposed to remind you that will the ribbon cutting contingent please meet us in the front, and we will see you all around. Thank you so much.